majority of the patients that come to me will say, I think I'm pretty much healthy. And then when we start going through the day, they're surviving on 5 hours of sleep. They have interrupted sleep at night. They have tons of blue light exposure. They're living off of high stress. And we take a step back and say what you thought was healthy and what was your norm may not be ideal to health optimization. And that education for many people can be life-changing. It was life-changing for me as an ER doctor. I was constantly in the hustle and bustle, and I'm like, I can do it. I can multitask. I can do it. I'm thriving as an ER doctor, but it was slowly chipping away from my lifespan. And I wouldn't know that until I took a step back and was like, I do need 7 to 9 hours of sleep. I do need to have moments of silence during my day. It can't just be boom, 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 and on to the next without moments of reflection.
Welcome to the Vibrant Wellness Podcast. I'm your host, Dr. Brooke Stubbs, and I'm here today with longevity expert, Dr. Poonam Desai. Dr. Desai is an osteopathic physician, double-boarded in lifestyle medicine and emergency medicine, and a North American Menopause Society certified provider. She's fellowship trained in point-of-care ultrasound and precision medicine, with additional specialization training in integrative and regenerative fields to help individuals optimize health and prevent disease. Dr. Desai is an influential leader in the health industry, working with high-profile clients worldwide. She's a TEDx speaker, social media educator, consultant, mom, and founder of both Longevity Place and Her Longevity. Dr. Desai, I'm so excited to talk to you today. Thanks for being here.
Of course, I'm excited.
Yeah, so we got to speak a little bit before the podcast. I want to start off with just tell me a little bit about precision longevity medicine. How do you see that? What's the kind of definition for you, for our listeners?
So what I see precision longevity medicine as is it's evidence-based, cutting-edge medicine. Standard primary care focuses on treatment. And once you have the disease, it's focusing on managing those diseases and symptoms. In precision medicine, we focus on evidence-based ways to prevent those diseases. And more importantly, we personalize that management to the patient. And I think that's how we differ from standard primary care.
Right. Absolutely. And when you look at your training and your background, how did you get from there into this kind of practice?
So as an emergency medicine physician working at a level 1 trauma center, I was seeing the heart attacks, the strokes, the cancer. And when patients come to the emergency department, they are at a very vulnerable state. In fact, many of them are maybe at the end stages of those diseases. And I always ask myself, what if 10 years ago, 15 years ago, 20 years ago, they could have done something different to prevent getting the heart attack, the stroke. And I started becoming very interested in preventative medicine. I'm a professional dancer, so fitness, nutrition, lifestyle was already a passion of mine. So I really took the time to go back and get board certified in lifestyle medicine and really spend a lot of time training to help patients not only increase lifespan, but health span. So adding vitality to the years lived.
Right. I think like so many people in this space, we come from a Western traditional medicine background. I know that I had a personal story related to moving from that bedside medicine into a more preventative approach. I also spent some time at New York Presbyterian Hospital doing a master's in nutrition. So then when I went to medical school, I kind of had this intuitive sense that there was something that we weren't addressing and we weren't learning. And I was working on the bone marrow transplant ward and seeing all of these patients and knowing that the nutrition that we were providing them in the hospital wasn't serving them. And I had this intuitive nature that really we should be doing some preventative work. When we talk about this, how do we really change the dynamic for patients and providers alike? Because I think so many of us are waking up to this, but it really hasn't come mainstream. What do you want people to know about whether they're coming from a provider standpoint or they're in the patient care system? how do we help change this landscape and try and get people healthier instead of reacting to acute care?
I think focusing on lifestyle factors is number one. Really speaking about and educating everyone from providers, physicians, practitioners to patients that everything starts in the daily habits that we're making.
Yeah.
And it starts at a very, very young age. And
Absolutely.
I think that's super important.
Mm-hmm.
Are you sleeping enough? Do you have a good diet
Mm-hmm.
that encompasses the protein, the healthy fats? And more importantly, does it avoid the highly processed foods? And all of that, I think, is super important when it comes to preventative medicine and
Mm-hmm.
longevity medicine, because we don't want to wait for the disease to come.
Right.
We want to prevent the disease from happening. I want to make sure that every single day I'm waking up and every single day my patients are waking up, we're living our best life. And I believe you can do that if you are at your peak health levels. And how can we get there? That's by having a solid foundations, focusing on just the basics. Everything else is cherry on top of the ice cream.
Yeah, and I think people maybe miss they don't understand how many of these chronic diseases that we live with or that people are diagnosed with can actually be affected by lifestyle.
I 100% agree. Majority of the patients that come to me will say, I think I'm pretty much healthy.
Mm-hmm.
And then when we start going through the day, they're surviving on 5 hours of sleep. They have interrupted sleep at night. They have tons of blue light exposure. They're living off of high stress.
Mm-hmm.
And we take a step back and say what you thought was healthy and what was your norm
Right.
may not be ideal to health optimization. And that education for many people can be life-changing. It was life-changing for me as an
Same.
ER doctor. I was constantly in the hustle and bustle, and I'm like, I can do it. I can multitask. I can do it. I'm thriving as an ER doctor, but it was slowly chipping away from my lifespan. And I wouldn't know that until I took a step back and was like, I do need 7 to 9 hours of sleep. I do need to have moments of silence during my day. It can't just be boom, 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 boom,
Right.
and on to the next without moments of reflection.
Yeah. And then you and I have such a similar story. I remember going through that training of lifestyle medicine, and once I was incorporating it for myself, really protecting that sleep like a religion and, being really consistent with exercising and choosing different foods, the energy shift, the whole change in how I approach the day, it was really palpable. And so it made my mission different for people. And so I want other people to experience that. And I'm sure that's what you want when people come to your office. When people come to see you, what is it that they can expect? What's the intake and how do you start the process for them?
Great question. So we do a 360-degree evaluation. And what I mean by that is we start with a very comprehensive medical history. I want to know when your period started. I want to know if you had birth control exposure at a young age. I want to know your family history. I want to know, your exposure to antibiotics. Do you have cavities? Have you had root canals? I feel like every piece of that puzzle is important. And so we do a very comprehensive medical history. And another very important part of that medical history is lifestyle. I could tell you to eat all the protein in the world from chicken. But if you're a vegetarian, you're not going to follow my advice. So what's really important is understanding the patient. I need to meet the patient where they are. And that's when the changes begin to happen. And you can't do that unless you spend a lot of time getting to know your patient. After that, we do a pretty comprehensive lab assessment. So really trying to gather all the data from their genetic markers, epigenetic influences, their VO2 max, their DEXA scans, their hormones, their cardiovascular markers, sometimes even imaging. So we get all the data and then we analyze it and we start putting all the pieces together. And first we understand, where do we need to make intervention right now, because you can't address everything at once. You have to go step by step. So we come up with protocols for the next 3 months, and then we reevaluate, reassess, pivot if we need to, and make sure that this isn't overwhelming for the patient. Nobody's going to go home and been like, I'm going to do a 180.
Yeah.
But we give them small changes that make a big impact. And that's where a physician comes in and says, listen, that red light mask may not move the needle as much. Let's get some extra sleep in.
I love that you say that.
And it's important. And it's important for them to hear that from a physician who is actively participating in their care versus them getting medical advice on TikTok.
Right. And all of those things, I love a red light therapy. It's, it's so soothing, and all of these things like PMF and infrared, they can all be adjunctive, but I think you're so right. Those foundational pieces are so important when we're starting out. Talk to me a little bit about the data collection. You mentioned genetics. You mentioned earlier some core lab values. How do you go about that? Where do you source those from for both of our patients and for our providers?
So there are many places to source, whether it's your genetics, understanding your SNPs. Do you have the ApoE4 gene?
Okay.
Are you a fast or slow metabolizer of caffeine? And, those lab markers to me are super important. If somebody's having a latte after dinner, but they're a slow caffeine metabolizer, they may not be getting the best sleep. And that is important for you to know, because sleep is probably one of the most important factors when it comes to our longevity. I myself am a slower caffeine metabolizer, and I was chugging Starbucks venti. And after I got to know that, I'm like, whoa. Like after, 10 a.m. or 12 p.m., I really have to avoid caffeine for my longevity. And I think knowing those markers is important for the patient. So really knowing their genetics, knowing their SNPs, knowing their lab markers, how metabolically sound is your health?
Yeah.
Where do you stand cardiovascularly? Where are your hormones? And there are plenty of ways to obtain these labs, whether you're using your insurance for the basic labs or you're using, labs like Vibrant Wellness.
Yeah. So we love some of the Vibrant Wellness labs because particularly my favorite is the cardiovascular bundle. And it really has all of those things. It's expanded more than what you would typically get on an annual screening exam. And then you can also, for providers, they may not know, you can pick and choose and kind of make a bundle for your patients and make it work for your patient profile. Now, you mentioned insurance. You have to cash pay through Vibrant Wellness, but you get so much more for your money, I think, than going through the traditional route. And I don't know if you experience the same thing.
No, yeah. One of my favorite panels when it comes to Vibrant Wellness is a Micronutrient panel. And the reason is because many of my patients come to me and they're like, what supplement should I take? So-and-so on Instagram told me I need to take this. And so told me I should take this. My friend is taking this. And for a lot of people, I'm like, your supplements should be personalized to you. And how can we personalize your supplements if we don't have data?
Right.
What is your micronutrient panel? What are you lacking? Where are you hovering on borderline?
Yeah.
And I think that's probably one of my favorite panels. And I think it's one of my patients' favorite panels.
I do think it gives a lot of insight. And people always ask me the same question, and insurance is not going to cover that.
Right.
They're just not going to, they don't even cover vitamin D most of the time. So, and we know that's a very common nutritional deficiency. Okay. So let's move on, because you mentioned protein, and I want to talk about that because you also talk a lot about fasting. We know that when you're fasting, you lower that mTOR pathway, which is helping to repair and turn things into autophagy for recycling and all of those things. When we're eating protein, we're revving up that mTOR pathway. How do you help patients balance those two things that are both so important?
So it's a very, very fine balance. And that's where personalized medicine comes in. It's truly personalized to the patient. There are some people I'm going to say, listen, intermittent fasting may not be for you. And then there are people who I'm like, okay, this is something we can start with. Whether it's 12 hours, 14 hours, 16 hours, 18 hours, it really depends on the patient's entire history, including lab markers. So I'd say it's not a one prescription for everyone. It really, truly needs to be personalized. I'll talk about me, for example. I thrive on intermittent fasting. I have better focus. I feel better. I meet my weight loss goals. But more importantly, during my eating window, I need to make a conscious effort that I'm getting all my nutrients in, I'm getting my protein in, and then am I doing the strength training to make sure that while I'm having some fat loss, I'm also building lean muscle mass. And I think there's a very, very fine balance, and that conversation, again, needs to happen with your physician.
Yeah. And you mentioned things like muscle building. I think it's so important that people really understand. I personally am mostly plant-based. I still have fish and eggs to a degree, which is much more in moderation than I think people in general will have around certain meats or animal-based products. But when I think about that and I think about what most people think plant foods are, fruits and vegetables are not going to get you there. They're not going to get you all your macronutrients. They're not going to get you the amount of protein intake you need. And how do you see that? I mean, we know there's so much benefit. What is the best diet you feel like that is the healthiest in general for a population?
The best diet, I think, for me, for anyone actually, is going to be the diet they're going to follow. And I truly mean that. Whether you are on a keto diet, a plant-based diet, a vegan, diet, a vegetarian diet, and all of them, mean something different to the patient. A vegetarian diet to me sometimes is different to the other person. Like in my vegetarian diet, I do have eggs. So, and my entire life called that a vegetarian diet. And now I know that may not be, but I ask the patient, what is your preference? Because we can try to get all the nutrients in based on your preference. I'm not going to ask a vegetarian to start eating meat. They're just not going to do
It's
that.
not going to happen.
Yeah. Or somebody who loves keto, who sees results with keto, somebody who's, heavy on meat. We really want to make sure that we meet them where they are. This is what they think works for them. And I think that majority of people know their bodies better than I'm going to know their bodies. Right. So we really try to educate as much as possible and then meet them where they want to be when it comes to their diet. And I want to add this in at this moment. America is not a country, I believe, that's protein deficient. And what I mean by that is we hear about protein everywhere, whether it's media, social media, and let's be real. Majority of America grew up on that McDonald's diet, right? They were getting the chicken nuggets. They're getting the burgers. Are they protein deficient? What America really is fiber deficient. How many times are you going to McDonald's and like, can I get a side of broccoli? You don't, How many times do you go to a restaurant and you load up on the fiber? You don't. But majority of people will order an item that has protein in it, you know? And so I think it's important to mention protein. It's important to let them know that they should be getting this protein in. But I think, majority of the listeners may have, dabbled in protein powders, in protein bars. But let's talk about fiber. How many of them are getting fiber at every single meal? Probably not a lot. So I try to focus on things that they may not be aware of and really what will move the needle the most. And so a lot of my education with my patients is, let's talk about fiber. America is fiber deficient.
Right. And the only thing that has fiber in it comes from plant foods, right? So getting your whole plant foods is the best way to really increase your fiber content in your diet. We know that's really healthy for the gut microbiome, feeding those really good gut bacteria that then give us those anti-inflammatory short-chain fatty acids. So I think that's just a good, is there anything else you want to say about fiber for our listeners that they can implement that today?
I would say don't be afraid of fruits and vegetables. There is a misconception that, oh my gosh, if I eat too much fruits, I'm going to get diabetes. And somebody who is metabolically sound, I think it's completely fine to be eating fruits and vegetables. Right. And it's important because a lot of people fear, oh, can I eat raw, broccoli? Can I have raw cauliflower? Can I have those grapes? Is it going to elevate my sugar levels? While that is good to have in the back of your mind, what I think is really important is to focus on avoiding the processed foods. If you had to pick between grapes and pretzels, I mean, to me, it's a no-brainer. We're going for the grapes.
Absolutely. Absolutely. I agree too. And this is just taking me to you have kids. I look at the snack menu, the calendar of the snacks, it's goldfish, graham crackers, pretzels, and you're going, there's no real good healthy food on this. All that processed refined sugar and flour is basically going to increase the pathways of inflammation like NF-kappa B, which leads to inflammatory cytokines. And so I don't think people understand how those processed foods that don't look like whole foods really affects their health. I mean, food is not neutral.
I am a big, big advocate of education. And, I'm that mom that is going to go to the school and I'm going to ask them because at the end of the day, this is about my child's longevity and I have to advocate for my child. And sometimes whoever is creating the school menu may not be as educated on on nutrition for
Right.
children.
Right.
And it's my job as a parent to go in there and be like, my daughter does not need this much pirate booties. Like that's not going to, and there was a time where somebody was like, well, they need carbs. And I was like, carbs from pirate booties is not going to do much for my child.
Yeah.
Please give her an apple. Please give her a celery. Give her celery and hummus, if you want to get that protein and that carb. But we need to stay away from the goldfish and the pirate booties. While that can be an occasional snack, it definitely should not be a staple on your nutritional menu for a child's lunch.
Yeah.
And daytime. And my child and majority of our children are going to school Monday through Friday. They're not only learning math and English, they're also learning about nutrition.
Absolutely.
And I think it is up to the school to not only teach them English, math, history, but nutrition. Their longevity is really important. Their health is really important. And I think that we should hold the schools responsible for that your menu is teaching my child what nutrition is.
Yeah.
And it's really hard because at home, I'm all about whole foods. And then she goes to school and she's like, Mommy, I really want the pretzel. I want the goldfish. And she's right. I would too.
Right.
If you gave
delicious.
if you gave me an apple and, a chocolate cake, my eyes are going to go towards the chocolate cake.
Right.
My mind is going to be like, oh, I really should eat the fiber. But I can't expect a 5-year-old in that moment to make that decision. It's up to the school to offer healthy options and facilitate that decision making, not leave the onus up to the child and then the parent in the background to be like, please choose the vegetable,
Right. I agree with you. And when we talk about making those decisions, it's easy for me now. I've really narrowed down my diet to what is healthy. I've taken out those processed foods. So now when I have those, I'm really, really intuitive to how it feels in my body. I immediately feel aches in my fingers. I get headaches more frequently. My belly gets bloated or upset. And I think that releasing all of that inflammation and really burning down that, like putting out that fire of inflammation and then starting over, you really get a sense of those red flag symptoms. When patients come to you with these red flag symptoms that they're ignoring, that they think are normal, what is it you see most often that you want to tell patients, like, pay attention, something's going on here we need to pay attention to?
I think bloating.
Yeah.
Bloating is one symptom that I'm like, that's not normal. You shouldn't have a cauliflower and then immediately feel bloated. Many people do think that's normal. Like, I just get bloated with these foods. And, I ask them and I myself have to take a step back and say, why? Why is this happening? Why are you getting bloated with vegetables? Because that is a staple food.
Right.
And so I see patients with variety of complaints, but the most important thing is to take a step back and find the root cause. Where is this stemming from? What do we need to work on? Do we need to work on your metabolic health? Do we need to work on your gut microbiome? And, majority of people need to do some amount of work on almost all aspects of health.
Right.
But really figuring out which one are we going to focus on today, right now, the next 3 months.
Right. That's so good. So let's switch gears a little bit. You mentioned a little bit about peptides. And it's such a fine line. We don't have to get deep into it, but it's such a, right now in the longevity space, a lot of practitioners are using it. We're diving in before FDA approvals. These things are injected. We don't have a lot of information about long-term side effects. People want them in your clinic. How do you approach that? What do you tell your patients? Do you have a favorite? Do you think they really work? Do you think that this is a future of medicine, or are we giving too much credit to them? Give me your thoughts.
I think peptides are a very exciting topic right now. And I think it's very exciting in medicine as well, because they may hold some amount of promise when it comes to our health. Peptides may be beneficial when it comes to fat loss, cognition, muscle building, your metabolic health. We are seeing that there is some room for peptides when it comes to health benefits. However, you're right. There is very little FDA oversight. There are not enough clinical studies. And as a physician, I think clinical studies, evidence-based medicine is super important. So I would view peptides like I would with any medicine. You want to really weigh the benefits to risk ratio and then personalize them to the patient. I think that is the most important takeaway. Peptides are not a magic bullet, and taking a peptide is not going to move the compass 180 degrees. And it's not going to move the compass significantly. But I do think there may be room for peptides in the overall management of a patient.
Yeah, I agree. I think that you have to educate the patients, then they have to make that decision for themselves. The other thing, one of the biggest peptides that we know about are the semaglutides or the tirzepatides, these GLP-1 and GIP agonists. When we talk about those, I have seen such fantastic results in my patients, when they're followed correctly and when we have fiber in our diet to decrease some of those potential side effects. How do you approach that? What have you seen in your patients? I've seen like the confidence that they get, but what have you seen?
So when it comes to GLP-1 agonists, I think they are such a crucial tool in 2025 when America is battling obesity, when we're battling overweight, and when we have a lot of patient population that has visceral fat. So GLP-1s not only help with diabetes, weight loss, but we now know they can help with sleep apnea. And how important is sleep? That is the foundation of our health, and we need to be talking about that as physicians, as providers. We not only need to educate the population, but even other physicians who are hesitant to explore it. GLP-1s are like any other medication. And a lot of people want to focus on, they cause weight loss. Yeah, that's a great benefit of GLP-1s, but they have many, many other benefits, from decreasing inflammation, decreasing joint pain, So people see many other benefits. And I like to honestly give my patients the full picture. Carrying extra weight, obesity can increase your risk of multiple different cancers. And here we have an FDA-approved drug
that will take it away.
that can be used to benefit you. So we should take note of that. And it's not a new drug. I mean, GLP-1s have been around for a very long time. We just started taking note of it and noticing it.
Right. And I think it's so crucial. You say having excess fat is a known risk factor. I think so many times people don't know the long-term side effects of a GLP-1 and that keeps them away. Well, we already know the long-term risk of having overweight and obesity.
Exactly. And that is what I tell my patients. And many of the people who are against GLP-1s are okay with their patients having alcohol. And to me, it's kind of like, we have an FDA-approved drug that can help reduce obesity, overweight, that will help you decrease many chronic diseases. And then we have something like alcohol that we know has zero benefits. So if we're okay with our patients having an occasional drink here and there, why are we not okay
with them trying this tool?
Trying an FDA-approved drug?
Right. I know. I agree. So when we talk about weight gain, this is one of the things that I see a lot in my patients. They've had children. They're maybe in their late 30s, early 40s. They come in. And as much as I'd like them to come in for the other red flags, like the headaches and the irritability, they're coming in because of their weight. It's such a public sign. It's given so much credence in terms of worth in our society, which I just think is wrong. But at any rate, that is what brings them in. How do you approach that? Tell me about this transition phase and how you see things like perimenopause and menopause and all the symptoms involved in that.
So I'd like to say that when many people come in with perimenopausal, menopausal changes, a lot of times they're willing to ignore the other ones. Oh, I got a few night sweats, or, I have a little bit of brain fog. But when it comes to their confidence and, people they want to take more control. They want to do something about it. Like, I noticed that weight gain, I better go do something about it. And I think that's completely fine. I embrace it. Like, thank you for coming to me and thank you for talking to me about this one symptom of perimenopause or menopause. But you also have all these other symptoms, and we're going to address them too. And we're going to address your weight, because I know that would bother me too. It's about my confidence. It's about how I feel in my own skin. And that is important. And we don't want to take away from that.
Absolutely.
How you feel about yourself is important for your longevity. Your confidence is important for your longevity. Your peace of mind in your own body is important for your longevity. So I embrace it. I want to address it. And I want to make sure that we, meet the patient where their goal is, and maybe even adjust those goals.
Okay. And how do you see estrogen either playing a role in that? We know that there's estrogen receptors all over the body. How important is estrogen to longevity, long-term health?
Let's talk about the evidence. The
Okay.
evidence is there that, as you know, hormone replacement therapy, bioidentical hormone replacement therapy will not only help you with those hot flashes, but it has cognitive benefits. It has benefits with your bone health. It has many, many benefits. So I am a huge proponent of bioidentical hormone replacement therapy when needed.
How early in somebody's transition are you amenable to putting them on hormone replacement therapy to kind of give them those extra added tools to make their life just a little bit better?
Again, I'm going to say it's very, very personalized. There's no date. I'm not going to say a year before this happens, we need to start hormone replacement therapy, because the true answer is it is truly, truly personalized. When are you getting the symptoms? What is happening with your menstruation? You know, and so we take all of that into context. And that's when I would decide, based on the patient's medical history, symptoms, is it time for us to start adding bioidentical hormone replacement therapy to your overall regimen?
And do you wait until they're really showing signs of a change in their cycle to get them on hormone replacement therapy? Or do you see that people are transitioning and losing do you see that they're losing some of their hormone earlier in this perimenopausal phase and maybe need a little bit more support before they get to that menopause diagnosis?
Well, let's remember, menopause is a day, right? It's 365 days without your period. So when people say I'm in menopause, I was like, you're only in it for one day, 24 hours. So you're either before menopause or after menopause. And we don't want to wait till that day when your hormones are all gone.
Okay.
Right? So to me, I feel like we should start putting those hormones back in as they're slowly declining, or even when they're rapidly declining. But again, I don't have a specific date. It really, really depends on the patient.
Absolutely.
But I do know you don't need to wait till they're all gone to replace them, because they have so many benefits, and you want to make sure you're addressing the symptoms of the falling estrogen, progesterone, testosterone. You don't want to wait till they're all gone and we already are seeing the diseases show up. The symptoms are full blown. I mean, why suffer when you can start adding them back in a little earlier on before that day of menopause?
Yeah. So you've taken in your patient now, you've collected all of their very in-depth history. You've done a data analysis on their lab work. You've figured out what micronutrients they're missing. You've helped them with their lifestyle, their sleep, their nutrition. Talk to me. And then you've determined what supplements they need based on their own profile. Then there's those cherry on the top things that you offer in your space. Cold plunge, hot plunge, steam rooms, saunas. Tell me, what's your favorite? What do you feel like really moves the mark for patients? What's got the most impact?
So out of all the wellness technology, I'd say if you had to focus your attention on a few, let's go back to the evidence. I feel like the sauna and maybe the red light therapy have the most amount of evidence when it comes to males and females.
Okay.
So I'm a big, big proponent of the sauna. You know, you want to try to do 3 to 4 days a week, get in there for at least 20 minutes. So the sauna, I love red light therapy. I think we have some great studies showing many, many benefits to red light therapy. A cold plunge done in limitation in the right person at the right time, I think also has several benefits. So I think there's room for a lot of wellness modalities to be added to your routine. But I'd say if I had to pick between a 30-minute sauna and getting my sleep in, that's when I'd have to decide of how did my day go? Am I, you know, and that's where I help educate the patients. Like, if you only have an hour, let's make sure that we are doing the things that will bring about the biggest impact for your health.
Yeah, I love that answer. And then when you talk about these things, timing is important. Maybe it's a little bit different for different people and how that they respond to cold plunge or saunas. But let's take us through your optimal day, on a day when everything's good, where things aren't really hitting the fan that day. But take me on a day where everything's sound, your foundation is there, from when you wake up to when you go to bed at night. How does that look, and how do you time all these things for your wellness?
Great question. But you know, my day really starts the night before.
Okay.
And that's really important to note because how my morning is going to go depends on how much sleep I got. And that depends on when I went to bed the night before. So I'd say my day is really shaped from the night before. So I really want to optimize my day based on the sleep I got the night before. So I'm already thinking about my day when it's time to go to bed that, hey, Poonam, you really need to get to bed at this hour because we got to get the kids to school. We have to go to work. You know, you have this whole day planned ahead. So I really try to get into bed between 9 p.m. and 10:30 p.m. Like I really try to make that the focus for the night before. If I got great sleep, then I'm going to wake up and I'm going to say, okay, we got a great amount of sleep. Let's focus on a certain type of exercise today. So I think exercise is huge. So I try to make sure that during my day, I incorporate exercise. And you know what? I'm a working mom. I'm a mom to a 1-year-old and a 5-year-old. So I don't really control my schedule as much as they control my schedule. I don't even control my nightly sleep. You know, I may have my 1-year-old crying at night. I may have my 5-year-old who wants to get into bed. But it also starts with education. You know, my husband, I'm like, please don't set your alarm that loud at 6 a.m. because it's not my time to wake up and you're interrupting my, you know, deep in REM sleep over here. And I don't want to break that cycle. So you really want to focus on uninterrupted sleep. So it's having conversations with your family members that, you know, and my husband has it with me. He's like, you have heavy feet. Can you not walk that, you know? Can you not walk like that because you're interrupting my sleep? But so really acknowledging each other's sleep health is important. And, you know, my 5-year-old kind of knows that. She wakes up before me majority of the days and she'll come into my room and she'll play with her toy on the floor until it's time for me to wake up. But that came with a lot of talking, education, and helping her understand that mommy's going to be sleeping in the morning and it's really important for my health so I can play with you, so I can do all the things that you want me to do and be as energetic as you need me to be. And she's come to a point where, you know, she needs to be by my side in the morning, which is fine, but she'll be on the floor, she'll play, and then she'll wait for me to wake up. And I think that is a great start to my day because if I was sleeping and I got woken up at 6 a.m. and I tried to go back to bed until 6:30, my day is not going to start great. I'm going to be grumpy.
Absolutely.
I wake up, I hydrate, I get my morning dose of coffee in, try to get a workout in, and then I spend time with my kids. I think for me, that's what's really important is what am I going to regret when I'm 80 years old?
Yeah. What are we doing this for?
Yeah. What are we all doing this for? And I think everyone for their own longevity needs to ask themselves that is that 80 years down the road, do I want to be known as, you know, somebody who worked really hard in that clinic, you know, or somebody who did X, Y, and Z? Or is it going to matter to me if my child says, I remember you being there. I remember you being present and having a very, very healthy relationship with my children. And I had to ask myself that. And to me, the most important thing was when I'm 80 years old is to look at my children and say, I am very happy with what I did to build this relationship. And that's just me. That's what's going to make me happy at 80.
Absolutely.
And so my day is really structured around them.
Yeah.
I work between pickup and drop off. I really want to be present at pickup. I want to be present for those activities. I want to be present at bedtime. So I've created a life for me where I can be present. And then when I'm working 100%. And my mind is there.
Yeah. I need to get to that point. I still work beyond when our kids come home from school, but I have done some of that really hard work. I mean, I think that so many people get into the grind. That's typical Western culture. And they don't see that there's any way out of it. It's you tolerate what you're willing to tolerate. And I think it's so important. Sometimes I'll give prescriptions to my patients to scale back their work hours because it will inevitably lead them to burnout. And that stress is really affecting them on a cellular level.
100%. And I think, you know, I don't want to mislead people and say I don't work after my kids come to school. I may work after my kids come to school, but it's a conversation that, hey, mommy is a doctor. Mommy needs to work. And that's important to me because that's my passion. And I talk to my kids about it. I mean, she's at an age where I can have a conversation that, hey, mommy needs to see a patient. Mommy needs to talk to somebody. Mommy needs to do work. So while I'm doing this, why don't you do this? And we both can, you know, do our own thing. And then we'll come back and meet again. Yeah. In an hour, in 45 minutes. But I like that structure in my day where I can have her by my side, but she knows that mommy works. Because I think it's important for my child to also see me working.
See that. Yeah, absolutely. Okay, so we're about to wrap up. I just want to ask one more question. There's so many trends out there. how do people find, is there a particular trend that you hate seeing right now and you want to clarify the truth? Or how do you help people find the truth or seek out the truth in the midst of all these trends?
So that's probably a challenge that many, many physicians are facing right now, right?
Mm-hmm.
Their patients are coming from looking at things on social media, on Instagram, on TikTok, and saying, look, this is what they're doing. This is a lab this person got. This is a medication this person has. I want to be doing that. I think that's amazing that we have a platform where people are going to it and learning about things that are health related. People are focusing on their health, focusing on their longevity. So I embrace it. But when they come to me, I break it down to them that this, celery juice that you're going to drink in the morning, that you're going to spend, maybe 10 minutes making, may not move the needle as much as you getting that strength training workout and sleeping. So let's focus on the big picture. Let's focus on habits. And let's make sure that the things that you are doing are going to move the needle the most. And if there are things that you'd love to do, like buy a red light face mask or microneedle your scalp, you can definitely get that in. But if you had to pick and choose, we want to make sure that your limited time as a busy mom or working or working person or somebody in a relationship, you're busy. So we really want to make sure that we're maximizing your time and getting the most benefits on it. So honestly, to me, I embrace everything that patients come for. And it really tells me what their interest is. Like if they're coming to me asking me about microneedling the scalp, I take a step back and say, okay, so are you worried about hair loss? Are you worried about, let's talk about that. Do we need to do certain lab markers? So whatever trend that they're coming to me, asking me about, there's a reason.
There's a vested interest.
There's a vested interest.
Right.
And so figuring out what that is and then trying to address the root cause, and they can add all these gua sha, whatever they want to add to it. But we're going to focus on the foundation. That's my job as a physician.
Wonderful. I love that. How can patients find you if they want to work with you?
They can find me at www.drpoonamdesai.com or follow me on Instagram at Dr. Poonam Desai.
Wonderful. Well, thank you so much for being here. And thank you all for listening today. And if you want to see more, please follow us on Instagram at Vibrant Labs.